Men's Health, Health Education Seminar. Notice: the information presented in this presentation is for informational and educational purposes only and should not be used to diagnose or treat any known or unknown medical symptoms or conditions. If you are experiencing any signs or symptoms of illness or think that you have a medical condition, it is recommended that you consult your physician. Today in the Men's Health Education Seminar, we will go over why it's important to you, the facts about men's health, what it means to you, provide you with quick tips, give an overview of your wellness tools, and go over your next steps, as well as provide references. Heart disease kills 27.2% of men of all races. There are various types of cancer that are associated to men, including lung cancer, skin cancer, prostate cancer, and colorectal cancer. Suicide kills 2.2% of men. Type 2 diabetes, and finally stroke, are among the top health concerns for men. According to the Centers for Disease Control and Prevention, the leading cause of death among males of all ages in the United States is heart disease, and this is followed closely by cancer. Injuries often associated with excessive alcohol consumption also make up a leading cause of death among American males. It is important for men to adopt appropriate lifestyle modifications and engage in proper screening techniques so that their likelihood of developing chronic disease is reduced and their quality of life remains high. Many health conditions, chronic diseases, and illnesses do not have warning signs. Traditionally, most Americans visit their doctor after the signs or symptoms of disease are present, or worse yet, after a serious medical episode has occurred. Unfortunately, by this time the individual is usually identified as having a health condition and is then placed on medication. Your best defense against chronic disease and illness, and subsequently reducing your own out-of-pocket expense, is early testing and assessment to identify risks, and prevention through lifestyle modification. True or false? Half the men who die suddenly from heart disease experience no previous symptoms. This is true. The CDC reports that heart disease killed 26% of the men who died in 2006, and half the men who die suddenly from heart disease experience no previous symptoms. 9 out of 10 heart disease patients possess one or more risk factors. This includes elevated cholesterol and blood pressure, diabetes, obesity or being overweight, a poor diet, physical inactivity, and alcohol use. This map shows us that heart disease killed 26% of men who died in 2006, which is more than 1 in every 4 men. Research shows that between 70 and 89% of sudden cardiac events occur in men. It is important to avoid smoking and secondhand smoke. Inhaling other people's smoke causes health problems similar to those of smokers. Quitting smoking has immediate and long-term benefits. Within 20 minutes after smoking that last cigarette, your body will begin a series of changes that continues for years. It is also important to be active for at least 2.5 hours a week. Include activities that raise your breathing and heart rates, and that strengthen your muscles. You don't have to do it all at one time. You can spread your activity out during the week and break it into smaller chunks of time during the day. It's important to keep track of your numbers for blood pressure, blood sugar, cholesterol, body mass index, or any others that you may have. These numbers can provide a glimpse of your health status and risk for certain disease. Be sure to ask your doctor or nurse what tests you need and how often you need them. If your numbers are high or low, he or she can explain what they mean and make recommendations to help you get them to a healthier range. Also, try to eat a variety of fruits and vegetables every day and limit foods or drinks that are high in calories, sugar, salt, fat, and limit alcohol. Prostate cancer by far is the most common cancer in men. More men die from lung cancer than any other type of cancer. About 90% of lung cancer deaths in men are due to smoking. The most important thing a man can do to prevent lung cancer is to not start smoking or to quit as soon as possible. Colon cancer is the third most common cancer in men. It is most commonly found in men over 50 years of age. Deaths from colon cancer could be cut by 60% if all people over the age of 50 received regular screening results. A lot of progress has been made in cancer research, but we still don't understand exactly what causes most cancers. We do know many factors that are related to higher risks for different cancers. Some of these factors are out of our control, but there are other things we can do to reduce these risks. Today there are tests that can help us detect some cancers that are in the earliest stages when they're still small and have not spread. The American Cancer Society recommends that after age 20, all men should get cancer-related checkups as part of general health visits. These checkups should incorporate health counseling if needed, as well as looking for cancers of the skin, thyroid, mouth, lymph nodes, and testicles. Pay attention to any moles, freckles, or spots on the skin. Plan for the future and maintain a healthy lifestyle by eating healthy, staying at a healthy weight, and being physically active. In the United States, one person takes their life every 18 minutes. Men are 4 times more likely to commit suicide. Risk factors include using drugs and/or alcohol to help cope with emotions, being unable to form or sustain meaningful relationships, divorce or relationship breakdowns, a history of physical and sexual abuse, imprisonment, unemployment, loss of a loved one through trauma or disease, mental illness, and painful or debilitating illnesses or conditions. In older men, suicide is most strongly associated with depression, physical pain, illness, living alone, and feelings of hopelessness and guilt. Getting help for people showing warning signs is very important, and there are a number of opportunities open to get people the help they need. Help can come from a variety of sources, including family, friends, doctors, psychologists, psychiatrists, psychotherapists, voluntary organizations, community health centers, local hospitals, and social agencies. In an urgent situation, never leave someone alone. Contact your family doctor or consult a mental health doctor. Offer those contemplating suicide help and assistance. Let them know that you are here should they need you, and continue to offer your support. Stay in touch with them. Support is vital to ensure that they are on the recovery track. "13 million men have diabetes. Healthcare costs for treatment run about $174 billion annually. There are several complications associated with type 2 diabetes. These include eye problems, nerve damage, poor circulation, heart disease, stroke, high blood pressure, gum disease, and hearing loss. Men who are obese or overweight are at an increased risk for developing diabetes, high cholesterol, stroke, high blood pressure, and coronary heart disease. 2/3 of adults in the United States are overweight or obese, and almost 1/4 are obese. Managing type 2 diabetes is usually only associated with monitoring blood sugar levels because this is one of the first important steps. Once glucose or sugar levels are in a normal range, it's important to improve overall health. It is important to decrease the risk for complications and maximize quality of life. This can be done by maintaining good control of blood glucose levels, identifying complications as early as possible, learning more about diabetes and related health risks. It is very important to work with your doctor and have regularly scheduled appointments. It is proven, studies continue to show, that people at high risk for diabetes can prevent or delay the onset of the disease by losing 5 to 7% of their weight if overweight. You should be sure to try to get 30 minutes of physical activity about 5 days per week. It is also important to consume low-fat foods and make healthy choices to reduce the amount of calories going into the body. The good news is, when you take these steps to prevent diabetes, you'll also lower other risks, including heart disease, stroke, kidney disease, blindness, nerve damage, and overall health problems. That is a big incentive to improve health. You can use the food log to track your diet and use the meal planner for diabetic plans to follow. You can also track your exercise and create an exercise plan using your wellness website. Enroll in the diabetes workshop or read diabetes-related articles on your wellness website. There is a variety of information available to you to help you reach your goals. There are also a variety of health logs available on your wellness website to help you track and monitor your screening results, including the weight log, blood glucose log, and blood pressure log. There are numerous meal and exercise plans to choose from so that you have a plan that is easy to stick to, and this will take some of the work out of your hands. What's your next step? Now that you know the top men's health risks, facts, and their importance, what do you do next? Make arrangements to get your numbers tested. Remember, the best thing you can do is take action to identify potential health risks, that you can take preventative steps before they become health conditions. Prepare for your health screening by writing down and asking your healthcare professional any questions that you have. Use your wellness portal to assess, manage, and track your biometric health numbers. And remember, if you think you have symptoms, out-of-range numbers, or a medical condition, contact your physician for follow-up and testing and retesting.